What would you say are the key determinants of success for new and growing practices?
Yeah, I guess, especially through these difficult times, it's interesting. I guess the first and most important thing, Drew, would be having a set of engaged and truly aligned physicians. And relative to that, something that we've learned, especially through this crisis, with some strong leadership skills, as well as a clear alignment between the health, the economic health of the practice and their compensation. So engaged, aligned physicians with some strong leadership in the physician cadre or ranks, if you would, as well as some level of alignment between physician compensation as well as the economic health of the practice. That would be one. Second, obviously, an acute focus on patient care and really managing the journey of the patient life cycle across the continuum of care. The ability to do that, I would say, is the second. Third, of course, which is very relevant to our conversation today, I would say would be having a sustainable, scalable, variable cost optimized administrative infrastructure. Again, I think each of these are critical: sustainable, scalable, variable cost, and cost optimized administrative infrastructure that is able to support the growth of the practice over a period of time in a predictable manner. I think that would be absolutely critical. And for that to happen, it's really important that practices understand what is the new core of their business and what is the ever expanding chores in their business. I think one of the big things this crisis is revealing is that groups that have a really acute understanding or can revisit that understanding and adjust to the fact that where they create maximum value is in patient care, and perhaps everything else might be really chore, would be something that would be pivotal to the group's success over a period of time. Additionally, I think if there's another thing that this crisis revealed is groups that have progressed farther in the road to value-based care, especially the ones that went down the journey of either pro-fee cap or all the way to global cap, they're going to probably be benefiting through this time frame. So having a really good strategic plan for the transition to value-based care and execution along those lines would be another key determinant for success. Another one that is more economically related would be just having a balance sheet. As you know, many independent physician groups typically distribute all of their earnings to the physicians at the end of the year. And so they don't really have retained earnings or balance sheet. And I think times like these actually reveal the criticality of having one. So I think having a balance sheet or developing a balance sheet over a period of time would be a critical issue. And then I think another one of the key strategic revelations of this situation has been the fact that the telemedicine genie is out of the bottle and it's here to stay. And so having an effective telemedicine strategy, not just telemedicine technology, but telemedicine strategy, which then includes not only being able to virtualize the visits that lend themselves to that, but then be able to monitor and enable the patient journey beyond that, such that through telemedicine, the patients are able to connect with the physicians of their choice, with whom they've had long-standing histories. So not just get a physician, but get the physician that they really want. And then for that physician to be able to nurture the patient through the journey across the continuum of care, even through a telemedicine platform, is critical. And then last but not the least, sort of in sync with that would be the critical ability to deploy technology effectively. As we know, one of the biggest challenges in healthcare has been that it's probably unlike any other industry where technology has actually drained this industry rather than actually improving productivity and efficiency. And so I think one of the other key ingredients of a successful physician practice would have to be an acute ability to identify the right technologies and then deploy them as business solutions rather than widgets. Those, I think, would be some of the critical key determinants of success.